Sound check 1 2 3. Sound check 1 2 3.
Good afternoon. It is not 9:30. It is 1:30. We're at the Emergency and Community Services Committee on November 21st, 2024. Joining us in the room today, we have Councillor Tom Jackson, Councillor Tammy Wang, myself, Councillor Alex Wilson, Councillor Cameron Crutch. Online, we're also joined by Councillor Narinder Nan and Councillor Brad Clark. Thank you all. I'd like to call today's meeting to order. As we have quorum present, we're good to go. Clerk Kohler, are there any changes to today's agenda?
The only change from the original agenda that was published was that the staff presentation for community safety and well-being, Toronto Community Crisis Centre and Hamilton's Mental Health Crisis Response, HSC 24040, has been added to the agenda.
As Councillor Wang would say, wonderful. So, yeah, may I please meet Councillor Wang, mover of the agenda, and grab a seconder. Thanks, Councillor Nan, to approve that agenda so we can get our meeting going. And that vote's coming up.
Okay.
And that carries 6-0. Thank you, committee. We are good to proceed with that agenda, which is next up. Is there any declarations of interest on any items pertaining to our agenda today? Seeing none, we can move on to the approval of minutes from our previous meeting. Can I get a mover and a seconder to approve the minutes from our previous meeting of November 7th, 2024? Thank you, Councillor Crutch and Councillor Wang. If there's no discussion, and I'm not seeing any, we can go right to that vote. Perfect, and thanks, Councillor Nan, for letting us know that you have to go for other council business shortly, but you'll stay with us while you can. Thank you, and that also carries 6-0. Okay, getting going. We are on to the staff presentations, item 8.1 on our agenda today. That's the Community Safety and Wellbeing Toronto Community Crisis Centre, Hamilton's Mental Health Crisis Response Report. And staff are here with a presentation on that. Can we introduce, I don't know if there's an introduction to be done or if we're just gonna go right to the podium, but we'll get that going.
Angie Burden, General Manager of Community Services, through you, Chair, to the committee. We do have a group of community partners that will be assisting with the presentation, and Rochelle Iokwoba, who is our Manager of Community Strategies, as including the Community Safety and Wellbeing Plan, will provide the introductory comments and the introductions.
Thanks so much, GM Burden. I think we're just getting text set up and ready to go, and then Rochelle will turn it over to you and team whenever we're all ready to go.
Thank you, through the chair. As GM Burden mentioned, I'm Rochelle Iokwoba, Manager of Community Strategies here at the City, also co-chairing our Community Safety and Wellbeing System Leadership Table, and I'll turn it over to Jen.
Hi, I'm Jen Sansaloni. I'm the Clinical Manager for Coast Hamilton and the MCERT team.
Good afternoon, everyone. My name is Dave Hennick. I'm a Superintendent for our Community Safety Division.
Hi, folks. I'm Emily Dakers. I'm a director with the Good Shepherd Nonprofit Homes Barrett Center.
Okay, so today we will be providing a presentation to speak to the report that has gone forward around our Toronto Community Crisis Service and Hamilton's Mental Health Crisis Response System. So to start us off, we'll provide a bit more context, background in terms of where the report came from. We'll walk through the recommendations as well as alternatives for consideration, provide an overview of the Toronto Community Crisis Service, as well as Hamilton's Crisis Response Service, and then look at the feasibility of the Toronto model in Hamilton. In terms of the context for this report, many of you might be familiar with community safety and well-being. This plan very simply aims to create the community conditions for everyone to thrive. We look at ways for people to feel a sense of belonging and safety and have access to service. And it is a legislated plan offered across Ontario, so each municipality has a different version of the community safety and well-being. Here locally, we have 6 priorities that we're focusing in on. And one of those priorities is around mental health and stigma reduction. And specifically, we're looking at how do we target a reduced number of ER visits in Hamilton, as well as looking at reducing the stigma around mental health illness. In May, we came to Council, as we do each year, to provide an update on community safety and well-being, and we had a few motions that went forward at that time. One of them was asking staff to report back on the feasibility of implementing a service similar to the Toronto Community Crisis Service model. And so today we are providing you with an overview of that model. Staff have worked really closely with the City of Toronto to understand the service, as well as Hamilton's mental health partners. In terms of the recommendations that you see in the report, there are 2 that are put forward to you. The first is highlighting that this report is the start of us understanding the status of our mental health crisis response system, and that we need to do more. There's a next phase of this report that we need to look at, and that there's great work happening through the Greater Hamilton Health Network, the GHIN, that we refer to, and there's opportunities for staff to work more closely with the GHIN to identify opportunities for improved coordination and integration of mental health services. The GHIN also reports back through Council to the Public Health Committee, and the next update will be June of 2025. The second recommendation that you see is just recognizing that there's more funding that's needed for the system, and there's funding from different levels of government that we need to be looking at. And so this recommendation puts forward that staff would continue to work with the different levels of government to get more funding coming to Hamilton. Now the alternatives for consideration. We do recognize that there's a lot of great work happening in Hamilton, and we're going to demonstrate that today. There's also a recognition that there's more that we can do to enhance the system. And this recommendation or alternative suggests that if we do want to enhance the system, we need a dedicated resource to do that. And so through this consideration, we are asking Council to direct staff to put together a business case for the 2025 budget, and that would provide the resources of dedicated senior leadership to work with the GHIN, with the mental health and addiction sector, to develop a Made in Hamilton integrated mental health crisis response. It's that single point of access and the coordination for follow-up services and supports. What we also are suggesting is through that dedicated resource, we would be looking at the implementation of a 211 response. And this could be considered in the work. We would look at full costing and a phased implementation of that as well. So that is for your consideration. We want to provide an overview of the Toronto Community Crisis Service. Our colleagues in Toronto were not able to attend today, so we will offer a short video and then as well a slide on the program. So let's just get the video up. So I do have it. Is that okay?
A mental health crisis looks different for everyone. Toronto Community Crisis Service offers the support you need when you need it the most.
Do you mind if we take a seat?
Our teams of highly trained mobile crisis workers provide free, confidential, in-person response to mental health crisis calls to Toronto residents 16 years or older, 24 hours a day, 7 days a week across the city.
I just recently lost my mother, so I was praying the way she taught me to.
They also provide referrals and connections to other services, resources, and information, and post-crisis follow-up supports. Identify them by their green or beaded lanyards, ID cards, or vehicles. Call 211 at any time to access the Toronto Community Crisis Service.
Thank you for that. We'll just scroll through. As you can see, the City of Toronto has several resources available to us. The video is just one aspect for us to understand the program. And so the other components of the Toronto Community Crisis Service that we do want to highlight is that it is a non-police-led immediate support and intervention for individuals in crisis. And for this program, it was launched in 2021, where Toronto developed the response to increasing mental health-related calls aimed at promoting well-being through compassionate, culturally sensitive interventions. It operates under the No Wrong Door principle, and Toronto services allow individuals to access help through multiple channels, such as 211 or 911, and it ensures timely response for support. Some of the key features for the Toronto model is that it offers a mobile crisis team, there's diversion of police involvement, culturally sensitive response, and integrated services with other local emergency services, such as police, paramedics, and healthcare providers. And then in 2024, based on the successful pilot that was implemented, they moved to a citywide program. And for the citywide program this year, it cost about $26.8 million to move citywide, though they do expect that to increase year over year. And I believe next year they're looking at $35 to $40 million to implement this program, and it is through the tax base. We also wanted to highlight that the City of Toronto acts as the service system manager for this service. So what that means is they provide the resource, evaluation, the contract management, and then they work with 4 service providers in the community to implement the program. Interestingly, City of Toronto has a community safety and well-being division, and it is situated within that division. And so now we do want to turn this over to our partners in mental health. And so we are highlighting 7 programs or services that are available in Hamilton, but that is not all of the programs. That is just a snapshot. So we just want to acknowledge that there are many other programs, though we're highlighting just a few today. So I'll turn it over to Jen.
Thank you. All right, so COAST, the Crisis Outreach and Support Team, was established in 1997, which was through partnership between St. Joseph's Healthcare and Hamilton Police Services. COAST was implemented after there was a tragic death of a 2.5-year-old boy named Zachary Antidormi. A woman by the name of Lucia was a neighbor who was living with schizophrenia and had believed that her son, who had passed away, was reborn into Zachary and had stabbed him to death. So there was a coroner inquest and everything done. one of the there wasn't a process that was implemented, and the process was there was many visits called to the residents, many frequent contacts, but there was no way of monitoring or discussing all these calls and visits. So COAST got implemented. We are 24 hours, 7 days a week, diversion, serving all ages, basically from the years of 2 years of age up to 100 years of age. We have a mobile response system. So the mobile response system comes into two segments. So we have the mobile response system, which is the mobile, which is with a non-uniformed police officer as well as a mental health worker. Our mental health workers here at COAST are regulated healthcare professionals. So they are governed by a body, so their assessments, they are accountable for all their assessments. They are registered nurses, occupational therapists, and social workers who go out and do the assessments with the non-uniformed police officer. We also have what's called a co-response model, which was implemented in fall of 2023. The co-response model involves two mental health professionals, so one being the mental health worker as well as a crisis triage worker who has a social service worker diploma, developmental psychology background, but also crisis experience. So they'll go out and they'll do the visit. So I'll go into the whole process of how we determine if it warrants a police response versus just a mental health professional response. In 2023, the stats, so we had alone at the Crisis Call Center, which is again the 24-hour, 7-day-a-week Crisis Call Center, 25,073 calls that were received to COAST. 805 of those resulted into mobile visits without any type of police intervention. So again, that's speaking to that co-response. 799 mobile visits involved that non-uniformed police officer, which was, again, a high-risk situation where there was safety concerns to one of our staff members. This is big because 23,469 of those calls were all diverted away from police presence. So that's key, that 23,000 of those calls, our crisis call center, they were able to safety plan over the phone, provide any type of intervention to anybody calling that was in crisis. There are 3.2% of those COAST crisis line calls resulted again in that police response. Also, a couple other stats that in 2023, 21 times COAST had attended hospital with clients. That was under an apprehension, which is Section 17 under the Mental Health Act. 8 times were voluntary, where clients said, you know what, I'm going to go, I'm agreeable to go to the hospital and be assessed. And then, 12 times were apprehended, and then the one time was the Mental Health Act form where a doctor had put someone on a Form 1, where the police had to go and bring the person to emergency psychiatry services. Also to note that our crisis triage workers, we have about 5 that work on a day, and we have 2 mental health workers that work a shift. So they run, again, the 24 hours. We do responses up to about 8 o'clock at night. So we aren't doing that 24-hour in-person visit, but we are doing it from 8 in the morning till 8 at night. But we are open for that crisis call center if anybody's in crisis and calls. All right, so we can talk about the MCERT. So the Mobile Crisis Response Team is MCERT, which was developed back in 2013. Again, these are mental health workers, again, that are governed by a college who work with uniformed police officers who respond to the 911 calls for individuals that are in the crisis. They responded in 2023 to 5,514 calls and assisted with 3,585 of the individuals. The rest were just calls to like criminal activity or just other things that didn't involve anybody being in that crisis. Also to note that our MCERT team, They go out, they do proactive engagement, they go to the parks, they go to the shelters, they stop in and see people on the street, they develop that relationship. So if they are ever in a crisis, that trust has already been developed. So they're doing a lot of that proactive engagement to people that are living out in shelters and on the streets. Our apprehension rates have been low for over the past 5 years. They significantly declined to 16.4%, which back in 2019, they were at 21.7%. So that's a big drop in the apprehension rates. Again, that's under the Section 17 of the Mental Health Act. Shorter wait times, of course, at emergency departments where police are not tied up in the emergency departments, as well as clients are not waiting long hours to be seen for mental health assessments. So also too, just in 2023, some stats that 714 people were brought to hospital for an assessment. Again, 588 persons were apprehended under Section 17, which was at 16.4%, and 72 clients were brought to hospital voluntary. And then 54 clients were brought, of course, on the strength of a Form 1, which was determined by a family doctor. All right, so I will talk about ACT. So ACT is a very intensive community treatment program that serves clients that are very complex in the community. Most of them are living with schizophrenia, but also have multiple comorbidities as well. A lot of the clients are also on Form 47s, that kind of stuff. So these are clients that are very complex. They're individuals that are age 18 years old with severe mental illnesses, again, schizophrenia, bipolar disorder, major depression. The team, there's only 2 in Hamilton. There's a strong need for additional teams. There's at least a 2-year wait for these clients to get in and to be followed. They utilize evidence-based therapeutic practices to improve mental health, housing stability, and life satisfaction. And they're closely monitored, again, by their case managers who do outreach, as well as they do see them at the clinic. They do outreach. They offer them, again, crisis support, as well as they make sure they're doing their daily drop-in for medications and that kind of stuff. Also, I just want to go back for MCERT, just to let you know that there are 4 teams on the road 7 days a week from 8 in the morning to 4 in the morning. So I just wanted to note that. So just before I let Dave take over, when I review the Toronto model, I feel that they've adopted what Coast has been doing for many years now. So I just wanted to add that in. And there was stats as well that in 2022 to 2023, they received 7,000 calls, where Coast alone in 2023 served 25,000 calls to the crisis center.
Thank you. It's a real pleasure to be here to stand shoulder to shoulder with all of our community partners, and just, really to be part of the mental health response in the city. So I'm going to start with, in addition to Mobile Crisis Rapid Response Team, which you've already heard about, and COAST, those are 2 programs that Hamilton Police are proud to be part of. We also are part of the Social Navigator program. This program is designed to reduce reliance on judicial and healthcare systems by guiding at-risk individuals towards appropriate agencies. The team consists of paramedics, police officers, social navigators, social navigator coordinator. We have a full-time and a part-time, and 2 youth navigators. In addition to that, I'm just going to go over something real quick here. The social navigator team, I had the opportunity this morning to actually bump into one of our EMS partners on the way over. He's been a 10-year member of Social Navigator. He expressed the joy that he gets every day coming to work, being part of the team. He's a full-time EMS worker, and explained the passion he feels recently they had lost a client of theirs to an overdose, and he was just explaining to me, just bumped into him in the hall before I came over here, and he said he was set to retire a couple of years ago and stays because he loves the work and has given him like a renewed enjoyment in the role. And so I wanted to share that. I bumped into him before I came over here, and you talk about the impact of the work that you have helping people in need in the city. And that was just shared with me before I came over here. So I thought that was very impactful. What you see, so the Social Navigator program was started in 2011. The team now is currently made up of 8 members. That has morphed into what is now called the Rapid Intervention Support Team. So we still have Social Navigator. We have our members that work there. And I'm just gonna go through that with you so that you have a good understanding of that. So in 2021, the Social Navigator program found that the needs of their client were more complex than the parameters of their skill sets. So our community came together in 2022. Hamilton Police applied for and received a community safety and policing grant. It's a local priority grant, which is built in community agency salaries. So the money that we receive for this grant is given directly to all the community agencies to hire staff to work alongside our current Social Navigator program. Right now, we're up to 11 community partners, and the money flows through the Hamilton Police through to the agencies. So among some of the agencies, we have St. Joseph's Healthcare, Hamilton Regional Indian Center, the John Howard Society, the YMCA, Interval House, Canadian Mental Health Association, Wesley Urban Ministries, Hamilton Paramedic Services, amongst others. This is an amazing program. Every day at 8:30 in the morning, the teams gather around to discuss clients and the needs of people in this city and how they're going to work together to address their needs. And I'm just going to see if I have any stats here that I can share with you. In 2023, most of the council members will be aware of this through, or the Police Service Board members rather will be aware of this, but we had shared our report on our stats. In 2023, 581 new people were referred to the Social Navigator program, and for RIST, for community partners, there was 212 referrals made. Self-referrals, 141, 30 by EMS, and in total, they provided service and assistance to 1,292 clients. Just anecdotally, there's so much for the city of Hamilton to be proud of in the way that they respond to and address mental health in the city. You have so many amazing community partners. Police have a role to play. We're part of the solution. We also have legislative requirements under the Mental Health Act, the Community Safety and Policing Act, but we are just part of the response, and our members take their job very, very seriously. We have a number of our members that are trained in crisis intervention training and to assist in de-escalation. I think it's important to know as far as threats to these services for us to consider as a city is that right now we receive a community safety and policing grant. It's $500,000 a year for 3 years, and that goes to pay the salaries of our RIST partners. In addition to that, we currently receive the community safety and policing grant, crisis response grant. That is $2,258,000 each year for 3 years for a total of just shy of $7 million, so $675,000. And so we have reapplied for that grant and have not yet heard back for that, but that pays for 14 officers. It pays for a Wesley Urban Ministries Housing Navigator, and the John Howard Society Court Liaison Worker. So, we're very, these grants are made possible, through the Government of Ontario, the Minister of the Solicitor General, through the Community Safety and Policing Grant. We're very grateful that those funds have been able to flow through to the city. But it is something that we need to be mindful of if we don't get that funding. Again, some of these programs or the type of response could be at jeopardy. So I just wanted to make you aware of that. And it's just a real honor to stand here and be here with our community partners. Thank you.
So Barrett Center for Crisis Response, we're part of the Good Shepherd Nonprofit Homes. Good Shepherd obviously has a vast variety of services throughout the city, some of which you may be more aware of and some less. So Barrett Center is a 16-bed residential mental health crisis program that serves anybody age 16 plus in the Hamilton region and also sometimes from the surrounding region. We also operate a 24-hour crisis phone line. So similarly to Coast, we have a little bit less volume. We take over 10,000 calls a year, and we divert approximately 100 calls a month from emergency services based on our interventions with them. Our residential program, so we have 10 beds that are for any referral source, so it means that folks can gain same-day access to mental health supports on a self-referral basis, so they don't have to go to hospital, they don't have to access through family doctors, et cetera, et cetera. So we try to make it as low barrier as possible. We also have 6 beds that are specifically justice-related beds. So we have MOUs in place with MCERT, Social Navigator Program, Coast, and St. Joe's Psychiatric Emergency Services so that they can refer folks directly to our program so that they can avoid apprehension, can avoid hospitalization, can avoid further justice involvement. We already know that folks are overly involved in the justice system, in the mental health system. So we look to divert them at the source. So instead of spending 6 to 7 hours waiting at psychiatric emergency services, because we know how busy it is there, they can come to us in 20 minutes and have an intake done with us. Anybody that stays with us is receiving an hour of one-on-one mental health supports daily while they're here. It also means that we are able to refer them to appropriate community services and supports, and then work towards a safe discharge location with them, which we know is always a difficult conversation. We have embedded harm reduction services in our programming, and our worker also carries a caseload afterwards. So for folks who are using drugs, which we know are often those who are experiencing mental health crisis in the community, also receive appropriate, timely supports for their addictions needs. We are a service that also serves a large number of gender diverse individuals, LGBT individuals, et cetera. So we do that in a way that is dignified for them. We have both female beds, male beds, and then gender flexible beds. As we know, folks are often asked to choose between the women's system or the men's system. We really look to be a part of the larger mental health system in Hamilton. I've mentioned that we have MOUs with all of the programs that are, almost all of the programs that are listed in this, and work very closely with all of the others as well, recognizing that in the 5 days that somebody's with us, while they're receiving those intensive supports, what are they going to have after they leave us? We also, for our justice bed folks, we have an aftercare worker who can continue to work with folks in community. We really refer folks to her that have high police usage, have high 911 usage, to create appropriate and effective plans of care to be able to decrease that, divert from that. We work regularly with Coast as well, so we have a great continuum of care, I think, between the two of us, in that they have the mobile services and the phone line, and we have the phone line and the residential services. So between that continuum, we're able to refer to each other to make sure that folks are receiving the most effective care in community. We serve around 4,000 unique individuals a year, over 1,000 in our residential bed stay program, and more than 3,000 unique individuals over our crisis phone line every year. So we're very grateful to be a part of this opportunity. Thanks.
Thank you to Dave, Jen, and Emily. There are a few other additional services that we do want to call your attention to, and that is through the Canadian Mental Health Association. They offer one of many intensive case management services. This particular program, Intake, streamlines the access to this case management for individuals that are experiencing serious mental health issues. We also work closely with the Greater Hamilton Health Network, the GHIN, and it should be noted that the GHIN is not a provider of service, but rather a coalition comprised of health service providers to transform the healthcare services in Hamilton and neighboring area. The Ministry of Health provides project-specific funding to the GHIN, and they convene and coordinate through the Mental Health and Addiction Secretariat, which we started this year. And there's great work that's happening through the GHIN. Earlier this year, there was the mapping of mental health outreach programs, and so we really utilized that report to inform this presentation as well. So as you can see, there are a breadth of resources in Hamilton, and it has been wonderful to learn more about those programs, and we see that the system is multifaceted, and there really are strong partnerships and relationships, as you've probably heard through Emily, Dave, and Jen, and many of our partners through the other programs are here as well today. We've only highlighted 7 of the programs. There are many more, and the GINS report earlier this year confirmed that there's about 19 providers that are currently offering outreach, mobile, or combined mental health services. And so our last slide just brings us to the feasibility of the Toronto Community Crisis Service in Hamilton. And so there are many elements of the Toronto model that already exist in Hamilton or could be enhanced in Hamilton. But we really want to recognize the great work that is underway in Hamilton. We have a 24/7 diversion response available through COAST and MCRRT. They serve all ages here in Hamilton, whereas Toronto is 16+. There's mobile teams that are active and part of COAST and MCRRT. What we have recognized is that the programs are operating quite well. There is an opportunity for greater system coordination in Hamilton. Programs and services do lack some of the funding to meet the demands. RIST is a great example where programming funding is not available past next year, and we know the great work that's happening there. And 211 has not yet been explored in Hamilton. So we do recognize that if we were to plan for a more coordinated single point of access for mental health crisis response, we do want to identify that significant time and resources, senior leadership, community collaboration, and funding is needed for that. It simply is not something that can be done on the side of anyone's desk. And so that is our analysis for you today. Okay. Thank you.
Thank you so much, Rochelle, and everyone else for coming in and delegating and sharing things. I have a bit of a question for committees. We have Councillor Clark and Councillor Kretsch on the speakers list for the presentation. My suggestion would be, given the presentation and the report are the exact same content, would be we just receive the presentation and then move into a speakers list, just seeking maybe a nod from you, Councillor Clark and Councillor Kretsch. That's good, great. Which also means, while that vote to receive the presentation, moved by Councillor Clark, seconded by Councillor Kretsch, is coming up, we can invite folks to maybe grab a seat at some other mics and be more comfortable for the discussion on the report, if that works well too. And so that was moved by Councillor Clark and seconded by Councillor Kretsch, just that we receive this presentation. And I believe that vote is up on folks' screens. Thank you. That carries 6-0. Councillor Clark, are you okay to introduce this report and get it on the floor as well?
Absolutely. Happy to move it.
Perfect. Seconded by Councillor Kretsch, and then we can start our speakers list with you, Councillor Clark.
Thank you so much, Chair. Thank you for the efficiency. First, it goes without saying that I have a deep admiration for all of the folks that are providing mental health services in our community, especially out in the community on an emergency basis, trying to divert people from the emergencies department, but very clearly trying to serve. Chair, I would go so far as to say that the vast majority of the folks who are doing this type of work treat it truly as a calling. They have extraordinary skills and abilities to go through a process whereby they gain the trust of the people who are in crisis and truly help them. So thank you. I believe everything that we have heard this morning, Chair, and this is a question to staff, is really the community-based mental health programming that we have in the city of Hamilton, whether or not it's through the police or the multitude of agencies that are providing similar services. Is that a fair question?
I think it is. passing it to GM. Sorry, I needed clarification, but if staff don't, then that's great.
Thank you, Chair. Angie Burden, General Manager of Community Services, through you, Chair, to Councillor Clark. I would say that we have focused the presentation specifically on the mental health crisis response from the point of an individual indicating they have a need and making that call. We want to make sure we're not saying that the agencies that have presented today represent the entire network of mental health and addiction services, but it gives you an example of how this part of the system works.
Thank you for that. And that helps me a great deal in my understanding of where we are, because as you know, GM Burden and you and I have spoken about this many, many times, there is a significant backlog or wait list for people wanting to be seen by psychiatrists or psychologists, especially with teens. The wait list is and I've spoken with many residents who have gone through this, and it's very challenging, especially for those families who have experienced a tragedy while waiting for that mental health assistance for their son or daughter. So I believe that is different than where we are here. So the second question I have, the funding that we have, or the funding that we're getting for this type of programming that we have here, I'm taking it comes from many different areas and not necessarily everything just from the Ministry of Health.
Through you, Chair, to the Councillor, we can confirm that, yes.
Thank you. And so, Chair, the alternative to the staff recommendations, and again, I have complete respect for what the staff have put forward, but where it indicates one of the alternatives is to prepare a business case for the 2025 budget that would provide resources for dedicated senior leadership to work directly with the Greater Hamilton Health Network and the mental health and addiction sector. The challenge that I'm finding, and I think our staff would concur, is we file these applications, but we really need to be directly involved with the GIN so they can understand and we can understand the process to make sure that we are getting all the funding we can, because Hamilton is very much suffering with the mental health crisis. So at the appropriate time, I would like to make that amendment. I don't think we're at the point where the review or on the 211 response, I would be keen to get more information on it and the costing, but I'm not sure that this council would be prepared to implement 211 given all the budget restraints. But we could certainly get the information and then perhaps consider in 2026. But I agree with all the folks that spoke this morning. We need a more coordinated approach. We need to ensure that we're getting all the funding that we can for all of the agencies, as well as the police department and the city of Hamilton. And that does not mean that I believe that the property taxpayers should be paying for services that should be paid for by the Ministry of Health. But this senior leadership position, I believe, will help us open the vaults at Queen's Park more appropriately. Thank you.
Thank you, Councillor Clark. Acknowledge that you're looking to come back at the end of discussion to that. I think other folks have the same idea, and so you may see that happen as we go through the speakers list. I think there's a couple of folks intending to move that alternative as we go. So on my speakers list right now, I have Councillor Kretsch, Councillor Wang, and if we don't get there through those two speakers, I'll come right back to you, Councillor Clark, or if there's other folks.
And Chair, I'm happy with anyone moving it. I just think that we need to do it somehow. Thank you.
Councillor Kretsch, followed by Councillor Wang.
Thanks, and you're reading my mind a bit there, Councillor Clark. I worked with staff ahead of this on the alternatives and sent some information to the clerk to see if we can get those added as amendments, so that we're not going to be doing different things, but we have A, B, C, D, in here to get a business case to come back to council as part of the 2025 budget to see if we can get some of that senior support to be able to do the work to prepare us for a conversation for possibly funding a 211 other systems in the 2026 budget. So pretty much exactly what you had said. And I had this conversation with staff and they said, hey, we'd like it if you could put that work forward as council so we have that direction. And so I'm happy to move that. I want to just briefly ask a couple questions before I got to that, which were about the gaps in the system. So I think every one of the presenters highlighted the approach we have, and I heard from staff that we want a system-wide approach here. One of the things about the Toronto system that's kind of nice is that it allows for an accessible, confidential, 24/7 service. And when I was listening to what people were saying, right, you were identifying gaps in terms of timing, in terms of accessibility, sometimes in terms of confidentiality, like the way this all works. Not every system works the same way, right? And so I guess I wanted to ask, if I could ask first, the first presenter, if you don't mind, just sort of what gaps do you see if you had the ability to do more? What would you want to be able to do as it relates to maybe services you see elsewhere?
Sorry. Additional staffing would be great. I would like to do, even if we could extend doing some of that in-person support in the evenings, you know, considering some people work later in the evening, so we'd be able to get out to see them. But also too, I didn't include in my presentation is we go out to the community now. Like before, we would wait for clients to call us. We are now a mental health worker, another health professional are going out to Indwell. We're going to the Central Library once a month. We're going to be partner up with St. Patrick's to develop that relationship with the community, to build that trust, because not everybody that calls us trusts us. So it's good now that when we go out to them, we're speaking to them. It's two healthcare professionals. There's no police presence involved. People are seeing that in the community, and we feel that there's a lot of trust that is being developed with our clients in the community. We're getting more and more people calling. Previously, some people, like, police are amazing. They're there when we need them. But there was some people, like initially when we were at the Central Library, you apprehended me, and people remember that. But now when they said no, now when they see that there was no police presence, they're like, oh, okay, now they're coming up to us and they're asking questions. And there is now that option of having a co-response going out again, depending on the safety risk. So if I was to, I would like to have another mental health worker and maybe another crisis triage worker added on to the program, and we could extend our hours and do more of what we're ever doing with that community outreach.
Thanks, that's helpful insight. And I'll say, just from my own anecdotal experience, having conversations with many people who do this work in our community, and there's so many groups that it would astound you to learn. There's certainly more than 25 groups. I know we have 25 kind of as a group we know about, but there's also other groups doing this work. And one of the things that are talked about is, wait a minute, do you have someone doing this work? Wait a minute, we have someone doing this work? And so, oh, okay, you're doing this work that's kind of like this. Our work is kind of like this. Oh, look, this is where it intersects. And so having the ability to come back in 2026 to council and say, we've had a look at the whole system. This is how we can make a systemic improvement to ensure we're filling all the gaps, I think is really what I'm trying to achieve by moving these alternatives into the main recommendation. And I'm not saying it's going to be simple or easy to do that, but I'm saying that I think having an additional resource at the city who can actually focus on that is important. It's not going to be easy to have conversations with 25 groups and coordinate this kind of work to identify the gaps, figure out what we can do to make it better, and ensure there's something that's free, confidential, accessible, 24/7 for members of the community. I mean, that video I think was actually quite exemplary. I've seen a couple of other videos they've done, but that was a really great encapsulation of the kind of support that people are looking for. And it's frankly what I hear from Ward 2 residents quite a bit, right? That there are situations that just fall outside of our traditional sort of services that we offer, fire, paramedics, police, and how do we consolidate those services and support them so that people feel like they can get these resources. So obviously, I feel passionately about this, and if it's okay with Councillor Clark, yeah, I want to move the amendment and move the report and kind of get that stuff to happen and get that done as soon as I can in this meeting so we can get to the next issue, but whenever that's the right time, let me know.
I'm going to go to Councillor Wang next on the speakers list, and then depending on any changes to the speakers list, that might be the time. Councillor Wang?
Both Councillor Clark and Councillor Critch have asked a lot of the same questions that I was kind of going with. I think mine is a little more fundamental, where I really want to understand who's paying for all of these services, because from a gut reaction, some of it's being done through the Ministry of Health, some of it's done through our Community and Safety Wellbeing Plan, I think, through the City of Hamilton. So I wonder if I could just get a higher level sort of look at how is this being funded?
Councillor Wang, are you talking about the services today or the recommendations, like the future, the proposed hypothetical future and the recommendations?
I think because when I want to go with where Councillor Critch and Councillor Clark are going for the business case, but I think I am just behind a little bit. So I really want to understand today, how does the funding work? Because then that'll help me better understand as they're putting forward a new business case, how that will change or how we will add additional dollars to said things to enhance this work currently. So for me, it's a fundamental, I just don't really understand the funding mechanism today.
There's lots of folks excited to weigh in on that. Rochelle?
Thank you, through the chair. There are a variety of different funding sources. Ministry of Health, I would say, is primarily the largest funder to the system, but our analysis right now really comes from the 7 programs that we spoke to today. So Ministry of Health, Ministry of Children's, Community and Social Services, Solicitor General, and the Foundation. I will point out that there is not funding from Community Safety and Wellbeing as a plan, but it is through Community Safety and Policing, a grant that is offered only to our partners at Police Services, and that supports RIST. So there are a few different funders involved.
That's very helpful, because it sounds as though even from a funding perspective, it's all fragmented and very robbing Peter to pay Paul kind of idea in order to provide a service. So I think that moving the alternative makes a lot more sense, because now we can have the business case where everything is kind of consolidated and we can kind of see it from a whole package sort of perspective. So thank you. I just wanted the opportunity to ask that fundamental question.
Thank you. I'm the only person on the speakers list with some questions. I'm happy to just ask those questions now. We move the amendment and then we go to vote. But if folks also want to do the amendment now, I'm open. Not seeing anyone. Okay, I'm happy to just ask some questions. There we go. Passing the chair to you, Councillor Critch. My questions are about what's coming back in this analysis, and I think Councillor Critch framed it in terms of gapping. And where do we want to be tomorrow or maybe in 2026, and how's building a budget case for 2025, and then how do we grow from there? The specific question I have, and I think the video from Toronto Community Services put it really clearly, we were meant to be getting the message that this is culturally competent care. There was SAGE, there was an Indigenous woman, there was a Black man, there was a very clear message that this is a different response. How we are seeing clients is different, how we are responding to clients is different. That was very, very clear from the messaging of that, potentially because of trust issues, potentially because of past issues, but it seemed very clear that Toronto was kind of marketing in a specific way. When we talk about the gaps that we're experiencing from this model we're talking about to tomorrow, sort of where we are today to where we want to be, I'm hearing that we're moving in the right direction on apprehensions on some of those things, and there's been changes kind of happening right now. I just anecdotally know that the same communities are having some of those worst experiences. Black communities, Indigenous communities are having that kind of happen at higher rates. How do we see equity and that specific piece being part of maybe a gap that might exist today? And where does the continuous improvement work, and how does funding that's potentially coming in lay into that? That's a couple questions together, but I'm trying to understand, how does equity specifically walk through this, and maybe how is that going to change, understanding that we're maybe not at a great place on day one?
Thank you, through the chair. I'll turn it over to Dr. Randy McCabe from St. Joseph's Healthcare, and then Melissa McCallum from the GIN.
Thank you. Hi, thank you for the opportunity to be here today. So I know from St. Joe's, we're doing a large part of the work with our partners. Equity, diversity, inclusion is really a key area where we're working towards doing better in that area. We're actually just in the process of hiring an Indigenous a director of Indigenous Health to lead us in this work, to bridge with the various communities, urban, Indigenous, and on Six Nations and the Mississaugas of the credit. So that is something that we're not in the place we want to be, but we definitely have it in our plan and working towards having all staff undergoing cultural competency to provide culturally safe care, have humility in interaction. So that's something as a whole organization that we take very seriously and that we're making those steps towards. So, and that extends to our crisis response. And then I just want to go back to Councillor Crouch, the gap, and you raised the gap. I think a big gap, and we had the ACT teams up there, because how do we help people prevent them from getting to a crisis? And that's our ACT teams. And I just want to point out a stat. We have 2 ACT teams in Hamilton. Those keep people well. Those are serving the people who are very, very ill and are the ones who are going into crisis because they're not taking their medications, they're not able to work or function, they may be unhoused. For our population of 800,000, an ACT team should serve 80 to 100,000 people. So for our population, we should have 8 to 10 ACT teams. We have 2. And just for comparison, London has 4. A much smaller city. So I just want to put that on the radar because I think someone mentioned about Queen's Park. We are meeting with the Ontario Health and really trying to advocate for our community, but welcome continued advocacy in that area.
Thank you. Just a one follow-up and then good on this one, but just maybe to our city staff as the business case comes forward in future budgets, I'm specifically wondering, I'm assuming that right now in the community, we don't necessarily have the most mature, the best possible, culturally, like there's some continuous improvement work going on, and we've just talked about scarce funding. I think it would be maybe unrealistic to expect that we're doing perfect here today. We're also talking about how do we resource this sector in a very, very big way. And I'm wondering maybe if just a comment on building that business case, how are staff thinking about the resources needed to build an equity lens into this as the program itself is being built? Sorry, through the acting chair.
Through the acting chair to the councillor. So I would say the strength of the alternate is in the partners that are coming together and already doing space in this work. So it was already work in this space. The city is not an expert through the community safety and well-being in provision of mental health services. And we are proposing that whether it's the initial staff recommendation or the recommendation that's the alternative, that we would be working with the member organizations of the Mental Health and Addiction Secretariat that has been convened by the GIN. And the GIN, and perhaps Melissa, who is here, could speak more to that equity piece. We are all on a journey in terms of equity, diversity, and inclusion and trauma-informed care, and that is really embedded in the way that the organizations are approaching their work. We would be providing resources to join that journey and to help to lead into a more system-coordinated response so that people know how to access care, when, where, and that partners are working together so that there isn't duplication and that we are all much more coordinated. Because Hamilton is a different community and Hamilton's on a different journey than Toronto, we would see this role as an opportunity to understand what is needed for Hamilton at this time. Adopting that equity lens as we go forward can include exploration of the 211 response, but could include other opportunities. And as I imagine this work, could include in the first 6 months an initial set of recommendations, and then perhaps some midterm and long-term recommendations as well. I would like to provide opportunity for Melissa McCallum, Executive Director of the GIN, to provide comment on the equity piece.
Thanks, Angie, through the chair. I actually wanted to take a little step back and say that, you know, we have a lot of expertise in our community, but how do we know exactly where all the gaps are if we actually don't look at that as a whole? So that's part of what we started to do back in the spring, is to even just take a bird's eye view of every organization that touches an outreach or, you know, crisis response. We have a lot, and everyone is suffering in terms of, if there's a little pot of money to come, everyone needs a little bit of that. So we know that there's not enough funding to go around. What is the most massive gap here in our community? And I'm not sure that we could today come to consensus on what that is. And that speaks to this need for better coordination and integration of the partners that are doing this amazing work and are doing it underfunded. And that speaks also to the equity lens. We have an enormous amount of expertise in this community, but how does it work together? How do we ensure that, a crisis response leans on, the Indigenous community or the BIPOC community and bring in those experts? I think that is a really important thing that we need to learn. We have pockets of excellence of equity in this city, and we have a ton of gap. But until we actually look at this type of response together across organizations, and then come to a collective on where the gap is and where funding should be, I think that is, honestly, in my mind, the first step. Because we do have quite a lot. You've seen a lot today, and there's over 20 providers on an everyday basis that provide outreach and crisis support in the community. So I think the equity question can be better measured by doing a deep dive into what people are doing and what gap remains from the people that are accessing these services.
Thank you for the, I'm noticing the time and seeing our speakers list, so just a thank you. I'll take back the chair, do the awkward transition. I think Councillor Jackson's jumped on our speakers list. Hello, Councillor Jackson, for comments or questions on the report.
I wouldn't use the verb jump, but I think I know what you meant, Chair Alex Wilson. Thank you. Appreciate the presentation from the comprehensive group led by Manager Ihak Waiba. And always good to see you, Superintendent Hennick, as well. So can I ask, I'm going to ask the bold question about, given the 16, 17 months that we've been dealing with the encampment protocol, and from what we've heard from many constituents of mine, and I know I've heard from other wards as well, when they've delegated, Chair Alex Wilson, about the mental health individuals that are in our neighborhood parks, those that are either on addictions of narcotics and or have serious mental health issues. I can tell you sincerely, my community wants these people to get the appropriate help they need. So through you to whoever wants to start answering this question, it could be a collective, is the Social Navigator program attending in these parks proactively, or are they doing it reactively when complaints come in? The CSWB, the Community Safety and Wellbeing Program, are they attending in conjunction with police and EMS and the Social Navigator program? I would like to, for public consumption, get some reaction to that, please. Through you, Chair Wilson, if that's appropriate.
Yeah, I think comments on how the existing programs, how the investments relate to encampments are, I think the other side of what's happening today is less, but it's more the investment. So yes, I'm letting you know where I think that line is and that you're on the right side of it.
Thank you for the leeway. Thank you, Chair Wilson. I just think it's timely with what we're dealing with.
Okay, thank you, Chair, and to you, Councillor. So our Social Navigator program and our Mobile Crisis Rapid Response Team both respond proactively and reactively to people that are in encampments all throughout the city. Us as police officers and all of our partners are all aware of the intersectionality between mental health, addiction, and homelessness. And we know many of the people that are in encampments in our cities suffer from substance abuse disorder and mental health. And so it's a question sometimes of what came first. Usually, from our experience, there's mental health and trauma associated with it, and the drug use that you see people engaging in is sometimes a coping mechanism for the trauma that they suffered. And so it's important that our response needs to be, or the issue is complex, our response needs to be nuanced. We have all the amazing and right partners here at the table to do that work, but trust that all of our members of our policing organization and our community partners, Coast, RIST, some of the partners that I listed here, we're responding to and assisting people that are living in the encampments in the community at this time.
Really appreciate that, Superintendent Hennick. And Chair Alex Wilson, that type of statement stated more often, more publicly, I think is the type of assurances that I'll speak for my community they want to hear from this collective, professional, extraordinary team of partners in light of everything we're dealing with the homeless and especially the impacts on neighborhood parks. I think that has to be said more often. Thank you, Chair Alex Wilson, for your leeway.
Sorry, can I add something as well? So on the risk team, we have 2 addiction workers that work with St. Joe's that go out to the encampments, and they start having conversations with the clients that are living in the encampment. So they are doing harm reduction. They are providing naloxone kits. They are educating them, you know, each other about if someone overdoses, this is how you administer naloxone. So they are going out and doing outreach, our 2 addiction workers from risk. And when Dave had talked about the funding, that's another worry about the funding with the risk, because we have 2 addiction workers from St. Joe's that are doing the addiction work, and they are going out to the people living in shelters as well as the encampments, offering harm reduction support.
Thank you so much, and further raising comfort level in a cautious way, but to know that they are dealing with it both proactively and reactively. Chair Alex Wilson, thank you.
Thank you, Councillor Jackson. We're at the end of first-time speakers. I'm going to turn to you, Councillor Crutch, as you've let us know you have an amendment on the way. And maybe you could introduce that and your seconder if you have one.
Yeah, it's not bespoke. It's in the report. And so thankfully, the legislative coordinator has already just kind of put them all together as an ABCD. And seeing as Councillor Clark and I have kind of been talking about this since the get-go, if Councillor Clark wouldn't mind seconding that we add C and D, and Councillor Clark's thumb is up, so I take that as a yes. And these are in the alternative section of the report if you want to just have a gander there, but here they are on the screen. And I guess the point is just when staff think they could bring that back is the missing detail here.
GM Burden or Rochelle, just a quick comment on which queue you're looking to be put in there.
I had a sense generally that it was going to be in time for the, anyways, I'll let them respond.
Thank you. Through the chair, we are looking for Q4 this year, so it would be fairly soon. Oh, my apologies. I was thinking the business case development. That will be soon, but the report back to ECS on the progress will be Q4 of next year.
So Q4 of 2025.
Thank you.
Seeing a nod from the mover. I think we're good there. So this is moved and seconded. It's all finished now. Councillor Crutch, if you want to speak to it, otherwise we can go to debate.
No, just maybe it's useful putting the Q4 of 2024 in the first part and Q4 of 2025 in the second part, just in case there's any confusion. But otherwise, I think that that's great. And thanks to staff for working out an alternative here that we can add to this so we can start to do some of that more systemic work and have that discussion as part of the 2025 budget and then the 2026 budget eventually.
So thank you. We have that moved by Councillor Crutch. It's seconded by Councillor Clark. And we can have it up for a couple of moments. We can have committee members ask any questions or do any debate. But after, once we're all ready to go, we'll go to that vote. I'm not seeing anyone jumping on the list to debate. Just going to, yes, Councillor Jackson.
I've jumped again. Thank you, Chair Alex Wilson. So can I just get clear, please? In A part, it's talking about the GHHN reporting back to council through Board of Public Health. So again, I'm not trying to semantics here, but should this not be through the new hybrid Public Health Committee, or do we want that to a Board of Health, which still exists? And secondly, the C&D now talk about back to ECS. So I'm just trying to get consistency, but maybe consistency is not necessary given the 4 different parts of this recommendation.
I think you've brought up some good points. GM Burden.
Thank you, through you, Chair, to the councillor. Thank you for bringing that up. We do see this work situated better, reporting up through the Board of Health, of Public Health, or the subcommittee versus Emergency and Community Services, primarily because the model that we have for community safety and well-being in the city is one of coordination, collaboration, rather than oversight or provision of direct services. And should this come back through the public health, we could at any point decide where in the city it could be located. But at this point, would feel it aligns more with the GIN reporting through the Public Health Committee. Thank you.
So everywhere that it says emergency or community services or Board of Health should instead say Public Health Subcommittee? Is that, I'm just asking, is that what was just said?
Just checking here, Chair. Yes, that would be appropriate. Thank you.
So
I'm
then
happy for friendly amendments to
Okay,
make that happen.
everybody understands what we've heard and where I was going with the gist of my question?
It's very appreciated, Councillor
All
Johnston.
right, thank you very much. Clerk, note that. Thank you.
Oh, a very good catch. Catching and jumping. We're just waiting a sec for those changes to be made. Is there any other debate on the amendment in front of us? Although that was a good catch on the report. And Councillor Clark, thank you, Jessica. Are we able to just take that down while some of that offline work is happening and we can hear from Councillor Clark? Thank you so much. Councillor Clark, over to you.
Thank you, Chair. Can I ask through staff, how long is it going to take to get this new public health advisory body up and running?
Do we have a first date for the Public Health Subcommittee meeting?
I believe that, through the chair, I believe that the Public Health Subcommittee's first meeting will be December 2nd, 2024.
So in a couple weeks.
Okay. I just didn't want to delay this process because it is crucial. Thank you.
Thank you. I turn that off. With that said, I'm going to just kind of again say I have an empty speakers list, and I think we have somebody moved seconded. We're going to vote first on the amendment, which is just to bring up C and D and put them in the main report. So take them out of that bottom section of the report, the alternatives, and put them in the main report. And then we'll vote on the report potentially as amended as a second vote. And that vote is now up. That amendment passes unanimously, 6-0. And now we can vote back on the main report as amended. Councillor Clark was our mover and Councillor Crutch was our seconder for the main report. Oh, but sorry, I'm hearing Councillor Crutch is our mover and Councillor Clark is our seconder. And I'm seeing thumbs from everyone, so that's how we'll do it. And that vote carries 6-0. Thank you, committee. And thank you to our presenters and staff as well. Really enjoyed this conversation today. We are going to move to the consent items section of our agenda. And just so committee knows, I've been asked by the clerk's team if we could maybe do this in 2 batches, if you will. So a batch on 9-1, 9-2, 9-3. We'll go through them one by one if there's any discussion. And then at the end, we'll do a vote on 9-1, 9-2, 9-3, receiving them all together. And then same thing with 5 and 6. We'll do discussion independently and then vote to receive them together if that works. So with that being the game plan, first up is 9.1. This is a Recreation Master Plan Implementation Strategy Update. Would I be able to have a mover and a seconder to put this report on the floor? Thank you, Councillor Wang and Councillor Maureen Wilson, if that works, to put it on the floor. Perfect. Are there any questions for staff on this Recreation Master Plan Implementation Strategy Update? I know we have Steve and other folks in the room. And Councillor Clark, yes.
Thank you, Chair. And my comments might be too granular, but when I'm going through this report, I don't see where we would capture the state of repair of all the playgrounds in the city of Hamilton, because at the present time, our staff, and through no fault of our staff, they only have sufficient funds to replace 1 playground a year in the city of Hamilton.
Looking over to our bench to talk about how playgrounds fit into the consent item, the item in front of us in the forthcoming report as well.
Thank you. Through the chair, Steve Savor, Manager of Sports Services. Thank you for the question, Councillor Clark. In terms of this report is really setting the stage for our secondary or next report in 2025 that really speaks to that implementation strategy, and it will include input for not only indoor facilities but outdoor facilities as well. We are working in conjunction with our colleagues from Landscape Architectural Services and Parks to identify some of those gaps. You will see in the body of the report that we will have some information that speaks to how we address outdoor facilities. Obviously, from a recreation perspective, parks is a key component of that recreational opportunity for our citizens, and the key state of repair for those amenities have been discussed in asset management plans in previous discussions through council and committee earlier this year. But to answer your question, those inputs in terms of the state of repair of our parks will be discussed and implemented as recommendations on how we address those states and environments in that regard.
Thank you for the response. And Chair, may I ask our staff, when would they expect that report would come forward for approval?
Thank you, through the chair. The report that we're speaking to, the implementation strategy, is scheduled for next year, Q2 of 2025. Again, we will be working with our colleagues in Landscape Architectural Services and Parks to make sure that we do consider and really present opportunities and discussion opportunities for those park assets in terms of the state of repair and how it affects our future planning and provision of those assets in the future.
Thank you for that, Chair. Yeah. Councillor Francis, Councillor Beattie, and I, we worked out a plan with our GFL royalties to replace 3 playgrounds a year, purely out of a frustration that only one playground could be repaired in a year in the city of Hamilton or replaced in a year in the city of Hamilton. I can't speak for them, but I found that really disheartening because we have playgrounds that are very old and they rust and they chip and they can become dangerous. I had a playground where the slide actually broke. There was a hole in the middle of it, so you slide down and then fall through a hole. It's important that we have the appropriate amount of funding to replace playgrounds that are in need of replacement. So at some point, Chair, just kind of a notice here, I will be pushing that, especially during the budget time, because it's really unfair on our staff, and it's certainly unfair for the families and parents who are using these playgrounds. So I just wanted to bring that to everyone's attention. Thank you.
Thanks, Councillor Clark. And as that Q2 report comes forward, I think a chance to see where that's there. That did spark some other folks on the speakers list. I'm going to go to Councillor Maureen Wilson.
I don't think this is germane to this particular report, but just seeking confirmation. We have an asset management plan for our recreational assets. And so that deficit, if you will, Chair, we understand it. Perhaps the question then is, what is going to be the relationship between this strategy and the asset management known deficit and the budget of how we implement that recreational master plan, through the chair?
Is there an intention to maybe change the funding strategy as bringing back the implementation plan, or how is funding being thought of in the implementation plan that's forthcoming?
Thank you, through the chair. That's a great question in terms of how we are dealing with the information that has been presented in other strategies and plans. From an outdoor perspective, we do know that there are a large deficit in terms of parkland assets, parkland and recreational assets in the outdoor realm. How that is manifested within this report, or how our staff are working on this, is through identification of how that priority is implemented. What are the funding strategies that we can take advantage of to mitigate some of those issues? It is going to be a difficult discussion because we do have quite a bit of assets. When I think about our park assets, we have over 300 outdoor assets in itself. So trying to prioritize those funding opportunities, trying to prioritize our planning, is going to be a discussion that this committee and council will have, and we hope to provide some information that helps us in having those discussions in this committee.
Yeah, thank you very much for that thorough answer. And I mean, like Councillor Clark, it's always within the domain of council to make these decisions about funding levels, and I appreciate that exercise will be rough, and it will be, I think, informed by, you know, how much is available, and then how much is has each councillor added to that in an effort to try and move these deficiencies or deficits along. But as the director stated, I think the more light we can put on all of these things as they relate to our strategy will help inform both of these exercises. Thank you.
Thanks, Councillor Maureen Wilson. Councillor Cameron Cretch.
Thanks very much. And now for something altogether different. My takeaway from this report was just very different than perhaps the conversation we're already having, but talking about if I'm on the right item, talking about a recreation master plan implementation strategy update gives us a chance to see ahead a little bit to what's coming in 2025 and allow us to understand better how we're utilizing the assets we have from a recreation perspective. This matters a little bit more too, because we have a few weird assets out there, right? Where we see, oh, as part of the recreation master plan previously, we kind of said we're going to get rid of this asset, but it's still there. And how do we retrofit those assets to make them useful until such time as they can be made better in the future, right? So I think of Eastwood Arena as a great example of that, where we decommissioned the ice a few years back. It's being used quite heavily now. Actually, the programming's improved by non-ice activities, but it still doesn't have some of the core things it needs to maintain itself year-round, like HVAC systems, those kinds of things. So what do? Do we put a little bit of money into this asset and try and keep it going before we decide ultimately we decommission and build something new? So I'm looking forward to seeing these updates coming in the new year, because I think there are a number of assets across our city that need that form of renewal, short-term, medium-term, and long-term. And this kind of an update and this kind of a plan allows us to see that more clearly and allows staff, frankly, to take council's direction and make these things happen. So I know sometimes in the lower city, it's important to try and speed some of this work up or augment it by using area rating funds. But part of the project here is also to see, well, how are we approaching this from an equity perspective? How are we prioritizing different assets in terms of an arena? Where are there other ice assets already? Where are there non-ice assets already? Where are there communities looking for more space? How can we maximize that space to get as many people into it as possible? So these are all the challenges I'm thinking about on a regular basis, because a lot of the assets downtown haven't always been maintained, or they're in a weird state of limbo. So I'm thankful for this, because I think it's providing us some direction piece by piece by piece and getting us closer to seeing how we can holistically address these recreation needs for everybody in our city.
Thank you, Councillor Cretch. Not seeing anyone else on the speakers list for this item, I'm going to suggest we move on to the next item, which is the Youth Strategy Annual Report. And then again, we'll do a motion at the end of the first four. This is another update on the exciting work that's been going on with the youth strategy. Are there any questions on this consent item in front of us? Councillor Cretch.
No questions from me. Just want to thank staff for this. I think it's important to do so, because we're trying to build something, I think, in this city around a youth strategy around hearing from youth and youth engagement. I think it was this year, if I'm still in the right year, where we had our first ever youth town hall here where counselors participated. I think 6 or 7 of us did so, and hoping again to bring that back next year at some time, either in the late winter, early spring. And we're working with some students right now to do it and hoping to get every member of council out here to participate in that. There are 2 different kinds of events, right? We have one youth event that's planned kind of in the fall time and staff lead where we get everybody to come out. Like this year they went to the school board and there's a whole host of activities and things for them to do. And then there's a chance for youth to come and actually speak to elected officials, feel like they can hear what's happening. And last year we also had MPPs there, the MP there, a mayor was there. This year again, hoping to broaden that scope, get more people out, more students to come out, more youth to come out and have those conversations, because their voice is very important. And it's very difficult sometimes to engage youth. So we have to do it in different kinds of ways. And I'll just say, as a participant last year, I thought it was very, really encouraging to hear what people were concerned about. And one theme really stood out, and that's a theme we talk about here all the time, which is mental health. Right? So the more we can learn about that, the more we can hear from youth, and the more we can ensure that the programming needs they have are part of the heart of what we do here, the more they're going to want to care about what we have to say and what governments do for them. There's a lot of disengagement right now, and one way I think to get that engagement back up is to see the issues they care about represented in the policies we put forward. So thank you for this work. I think it's very important.
And I think with those well-deserved congratulations, I'm not seeing anyone else on the speakers list for this item. So again, we might move to the next one on our list, which is the third-party operated recreation facilities. This is another consent item. Is there any discussion on this report? I'm pausing for a second, just given that if there's not, I'll put myself on the list. So if Councillor Crutch is Vice Chair, I can pass the chair to you.
So captured.
I apologies. I forget whether or not I've sent an email about this already to flag this, but is this meant to be exhaustive, or are there certain groups that were scoped out just from a very ward-specific angle? And sorry to be doing this on open, like happy to follow up offline, noticing some groups that maybe aren't included. Just wondering how holistic or what the scoping of this was supposed to be. And apologies if I'm duplicating an email I've already sent.
Thank you. Through the chair, Laura Kerr, Manager of Citywide Programs and Standards. The motion specifically asked for a report back of third-party operators. So that was the scope. It's when recreation transfers the responsibility of operation of a facility to a group. And so that's why you see that number there. We actually have several hundred active agreements with groups who access space, but we retain the operator status of that space. So that's the number you're seeing there that might be lower.
100% answers the question. Thank you so much. I can take back the chair and we'll see others. Councillor Maureen Wilson.
Thank you, Chair. Apologies, as I don't know whether this is in order and in scope, but on these third-party agreements, for example, will there be a report, given the identified risks, et cetera, and partnerships of the what contracts are in date and what are out of date, and when or when they're up for renewal? I know, in particular, there's one that is, at least the last time I inquired, was well out of date, and the, if you will, the monetary amount of it also is quite dated. Through the chair.
Through the chair, we have been working with our colleagues in corporate real estate. As you well may know, in AFNA a few months ago, there was an audit report on leases and licenses and agreements, and there are about 35 recommendations that the auditor recommended for management to respond to. We will be working alongside corporate real estate, CFEM, corporate facilities and energy management, who also hold a lot of those agreements, to respond to those recommendations, and specifically to your question, Councillor, identifying those overholds, those developing a system, a consistent system in terms of monitoring and evaluating those agreements is something that's underway.
Thank you. Director Savor, would you be able to remind me, to the best of your knowledge, when that report back on the management responses will be with respect to that audit? If you don't know, that's maybe an unfair question, and I can certainly take it offline.
Through the chair, we will be working on updates throughout the process. Some of the recommendations have timeline dates of 2025, some have 2026, but staff committed to having updates throughout the process to provide committee and council with a progress of how we're doing with those management responses.
Thank you so much.
Thank you, Councillor Maureen Wilson. Just pausing for a sec. I'm not seeing anyone else on this item, which brings us to the last of this kind of batch of 4, but certainly not the least. This is an information report about long-term care in Hamilton. Are there any questions or comments for staff on this report? Councillor Jackson, no jumping at all.
Thank you, Chair Alex Wilson. You're making me feel more athletic. Thank you. Through you to, oh, well, there she is, Senior Administrator Holly O'Diarty. Holly, I both am uplifted to some degree, but discouraged to another degree in reading this information report. So just to clarify, and please add additional commentary, because I got a few questions, Chair Wilson. On page 2, you talk about our wait list is 1,938 beds. And you also then refer to 368 patients on the crisis list. Is that 368 plus 1938 or the 368 part of the 1938? That's my first question, please.
Through the chair, Holly O'Duarty, Senior Administrator, Long-Term Care Division. The 368 are part of the 1938. Councillor Jackson.
Okay, thank you for that. Now, further down on that page, very sadly, we lost 90 beds, both through Blackadar closure and Pine Villas closure. And then if you go further onto page 3, it talks about hopeful replacements. So I'm encouraged by the fact that it looks like we're looking at an additional 438 new beds, Chair Alex Wilson, on page 3 in our community. But holy smokes, waiting almost 10 years for these beds to be constructed and active and occupied? Or am I misreading that? Through you, please, Chair Wilson.
Through you, Chair, to Councillor Jackson. In 2026, Shalom Manor should be opening in Q2 of 2026 with 188 beds. Happily to also share, McCassel Lodge will be redeveloping 44 and 20 net new beds. Again, hopefully Q2 of 2026. So that's an additional 208 beds that we're aware of. When there's construction happening, we're not always privy to that unless there's public announcements. In 2027, 2028, there's an additional 224 beds in the downtown long-term care facility. I just have to look at the name here, sorry. Pine Villa. That was a media announcement for 2027, 2028. So in the next couple of years, 432 long-term care beds should be coming online. And then the most recent announcement with the Schlegel homes, and again, there wasn't confirmed dates, Councillor Jackson, but approximate dates that were shared through the media release of an additional 438 beds. So by, again, approximately 2023, 870 beds that we're aware of that will be coming online into Hamilton.
So, Senior Administrator, that last calendar, 2032 and 2033, is that correct? And if it is, what's it again referring to? Because you said in 2026, 2027, it looks like a few hundred are going to come on stream. Awesome. But then I see the 438 for like literally 8-9 years from now. Can you just clarify that further, please?
Through the chair, that's correct, Councillor Jackson. There was a recent media release in regards to the Schlegel home moving forward with purchasing of land on the Hamilton Mountain, and they are going to be working to build 2 new long-term care home beds, and there will be 438 beds. Hamilton Continuing Care, in which they own, will be transitioning to another opportunity for either shelter beds or another, I can't recall what that piece was through Schlegel, but the 438 beds, again, they just purchased the land. There's lots of hoops to go through with the Ministry of Long-Term Care for building homes, and that's the length of time that has been shared again through the media release through Mr. Schlegel.
Thank you, Senior Administrator Odiardi, and allow a political comment. And this is no reflection on our wonderful staff at our two fabulous municipally owned long-term care homes of Macassa and Wentworth Lodge. This is totally unacceptable, Chair Alex Wilson. We have 1,938 patients waiting for long-term care. And we just heard from our senior administrator, folks, she's relaying information, so I'm using that information. Not shooting the messenger. I'm using that to say this is totally unacceptable because the 1,938 are probably in their frail elderly seniors categories, mostly in the average ages in the mid-late 80s, to my recollection in working with long-term care and our two fabulous homes. And hopefully they last another 8, 9, 10 years, that maybe then they'll get a bed. And even then, it's not matching the 1938 we meet. It sounds like it's going to match about maybe half of that demand. I thought Premier Ford had talked about, after going through the pandemic and all the situations primarily in private and not-for-profit long-term care homes and retirement homes, and some of the scandalous, unscrupulous situations we saw, the lack of proper standards of care, both annually, capital-wise, upgraded homes, food, and lack of PSWs and nurses to the appropriate amount of residents in those homes, and not daily fresh food in some of the cases as well. We heard about all of them, all these situations during the pandemic that sadly, Chair Wilson, exposed a lot of the unfortunate substandard situations. I'm just so saddened and angered at the same time that I thought the commitment was the Ford government was going to make this whole and had put multi-millions aside to build thousands upon thousands of long-term care beds, and that hopefully Hamilton would get its share to address the immediate need, not 6, 8, 10 years from now. Thanks for allowing my rant, Chair Wilson.
Thank you, Councillor Jackson. Councillor Clark and Councillor Wang also wanted to get in with questions or comments on this information report. So we're going to start with Councillor Clark, followed by Councillor Wang.
Thank you, Chair. And I am never backwards about being forwards when it comes to our senior levels of government. But from my experience working at St. Peter's Hospital and helping to develop the long-term care facility of St. Peter's residents, perhaps the city of Hamilton needs to look at their own planning process, because the delays that it takes to get these approved and built frequently lie with all the challenges that we have with the owner or the property owner or the developer trying to get them approved. So 870 beds over 6 to 8 years, that's a serious increase compared to where we are. It does not deflate in any way, shape, or form that there are 1,900, and I remember, I think it was 38. Oh, yes, 1,938 residents who are languishing either in hospital beds, in homes, their private homes where their family are providing all of the assistance, and some of them are suffering with dementia and Alzheimer's, which is really challenging for people who've never been trained to deal with folks that are experiencing those conditions. So while it takes a bit of time for these things to get approved and built, I am grateful that we are seeing such a significant increase in the number of long-term care beds in Hamilton. I'm not going to opine on whether they're private or not-for-profit. I just know that there is a desperate need for additional long-term care beds in our community. the idea of home and community support services, it's not working. There's insufficient funds to be provided to the agencies that provide that nursing care, personal support workers, and it's unfortunately it's falling to, as I said before, Chair, family members who don't have any experience in serving seniors who have dementia or long-term care. I am aware in my own ward of couples who are living together and one of the couples has serious dementia and Alzheimer issues. So I agree with Councillor Jackson that we need the beds quickly, but I think the City of Hamilton needs to work with the Ministry of Health to somehow find a way to accelerate and make the entire process more efficient. You know, a similar design building for everybody would be a lot easier getting it through with all the hoops for approval. Anyways, that's my rant for the day, but thank you to the staff for bringing this forward. I think buried within the report, there is positive news.
Thank you, Councillor Clark. Councillor Wang.
Chair, ditto to both Councillor Jackson and to Councillor Clark. I did want to ask in particular, though, there was one little section on page 2 of 4. As of November 4th, 2024, there were 66 alternate level of care patients at St. Joseph's and 95 patients at Hamilton Health Sciences, for a total of 161 patients in the hospitals occupying an acute care bed that they do not require, but remain there waiting for placement to a long-term care home. I wonder, Chair, if I could just get a comment on how does that sit within the GIN to help with coordinating something like that? Or is that with Senior Administrator O'Duarte's sort of responsibility? Who's doing that work in particular?
I'm not going to deprive you of an answer from the bench, Councillor Wang, but I'd offer the Minister of Health and the Minister of Long-Term Care might be near the top of that accountability list. But I'll pass it to Senior Administrator O'Duarte.
Through the chair to Councillor Wang, the Ontario Health at Home is the body that does all of the admissions for the province. It previously was Home and Community Care Support Services. And so when I chat with GM Burden, who previously worked in that sector, she always raises a good point when we're talking about, you know, what is the issues that we're having in Hamilton? Because there's people that live outside of Hamilton that can also apply into our community, if you will. And there's people in Hamilton that can also apply to long-term care homes outside of Hamilton. And so the numbers that we look at may not be truly just Hamiltonians applying into the LTC bed spaces. And there's also different lists that are available throughout the province. So some of the data is a little bit skewed of information that may come to us. In terms of the Greater Hamilton Health Network, they are a great advocate for us, Councillor Wang. I believe that our Greater Hamilton Health Network is the only Ontario Health team that has invested a long-term care advisory to support the issues that are in long-term care and some of the advocacy that we do chat about at our group. And I'm the co-chair with Dr. Henry Sue. The Greater Hamilton Health Network sits there, both of our hospital partners, our EMS team. There's many community partners that also participate to help support the needs of long-term care. In terms of the alternate level of care that you chatted about, Councillor Wang, I co-chair that table here in Hamilton with Leslie Gillis and a couple of other community team members. And we're always looking at barriers that we can break down to support residents to move into long-term care. The other important piece to understand is that long-term care home beds in Hamilton and in our surrounding areas are at 90% occupancy or greater. So there's not a lot of empty beds that there are opportunities for residents, either ALC and hospital, or those that are waiting in the community. And so when the beds during the pandemic, the ward beds 3 and 4 that were removed, that really caused issues for us here in Hamilton, because we had approximately 261 or 231 of those beds. And then the addition of those 2 long-term care homes that closed in the past year, we lost another 90 beds. And so the impact is really being felt in our area with the loss of all of those beds.
Thank you for that very fulsome answer. I think that just to lob on to what Councillor Clark was saying about hearing anecdotally about having 2 seniors that are living together and one suffering from dementia and having the partner taken care of, I think that that's also critical when we think about how aging is different now. And also, it's all systemic because we talk about hallway medicine and we talk about like code 0 paramedics, code 0 ambulances, and we also talk about hospitals are routinely over 100% capacity. So this is a huge challenge. Thank you. Thank you for bringing this, and I'm glad that we're able to have the conversation. Obviously, we can't do very much today about this, but it's nice to be able to have these conversations openly like this. Thank you.
Thank you so much. Don't know what happened there. We've gone through our speakers list on the first 4 consent items. Our mover was Councillor Wang and our seconder was Councillor Maureen Wilson. We're just going to call for a vote. So for the past 4 reports we've just been talking about, we'll vote to receive those now.
Councillor Clark, are you able to vote? Thank you. I can.
And that vote I was going to ahead of myself. That vote carries 6-0. Thanks, committee. Our next 2 are, and again, we'll do those as a batch as well, are minutes from advisory committees. The first one being the Seniors Advisory Committee and the second one being the Hamilton Veterans Advisory Committee minutes. Councillor Jackson, are you okay to be our mover? Councillor Clark, are you okay to be our seconder? Is there any discussion on the minutes from the Seniors Advisory Committee, 9.5? Not seeing any. Is there any discussion on the Hamilton Veterans Committee minutes? Not seeing any. Again, these are meeting minutes. And so moved by Councillor Jackson, seconded by Councillor Clark, that we receive those meeting minutes. And that carries 6-0. Thank you, everyone. Next up on our list is general information and other business. Councillor Crutch, are you okay to move our outstanding business list? I'll second that. Everyone gets on the scorecard. And we can go to that vote unless there's a discussion about the outstanding business list. I don't think there is. And apologies, but did we have a general manager's update or any other business for this meeting? No, then we don't need to receive that, so we're good. That brings us to the very last thing on our agenda, which is adjournment. Councillor Clark would like to move that. Councillor Wang is our seconder, and that vote is now up. Thank you, everyone, for participating or tuning in to the Emergency and Community Services meeting, just while we're getting our adjournment vote up, which it now is. Our next meeting is in the first week of December, back here, and I believe that's our last meeting for 2024.
Good job, Chair. Thank you.
6-0. Thank you all, and see you in that first week of December. Bye.